Hello everyone, my name is Dr. Aditya Gupta. In this video, I'll be talking about from a journal perspective, what are the normal causes of hair loss. This video is made for general public and a small amount for people who are appearing for NEET PG. So the most important cause of hair loss, especially in men, we should all remember is androgenetic alopecia. Basically the male pattern baldness. I've talked about it in a previous video of mine, the link of which you can find in the description. There's also something called as female pattern baldness, but let's not go into that. Now, what is the treatment of androgenetic alopecia? It's mostly minoxidil along with finasteride. The second common cause of hair loss is something called as alopecia areata. What happens in alopecia areata is there is an immune mediated destruction of your hair follicles, and since it is immune mediated, it is also associated with other immunological disorders, other autoimmune diseases, be it thyroid, be it vitiligo, and things like that. The treatment here in such a scenario would be steroids. It can be both topical steroids or it can be systemic steroids which are taken orally. The third reason for hair loss in any individual can be infection. Most commonly fungal infections which result in formation of those chorions and things like that can cause alopecia. Other important cause which everyone amongst us should realize causes alopecia is the stress. Stress can cause alopecia, stress can cause hair loss, and everyone should realize it's a very important cause of hair loss. You must have seen that, especially around the exams or around something stressful happening in your life, there is a definite amount of hair loss. So you might not know that you are leading a very stressful life, especially the young working professionals in our country. And you might be thinking, why I'm having a hair loss? The simple reason just might be stress. This can be not cured per se, but yes, this can definitely be improved with yoga, exercise, and leading a rather more productive life. Thyroid disorders are also an important cause of hair loss. Again, the treatment in such a scenario would be treatment with thyroxine or thyroid medications. Certain autoimmune disorders, be it SLE or rheumatoid arthritis, they can cause something called as psychotracial alopecia. See, the important thing I want to emphasize is the causes of alopecia are multiple, each having its own different treatment. Better to always consult a dermatologist, and depending upon that, your alopecia or your hair loss definitely can be improved if not cured. One important cause of alopecia is traction alopecia. If you have a hairstyle in which you are using, keeping the hair very tight, that traction, that pull itself can cause your hair loss. Should always remember that. So especially as far as stress is concerned or traction alopecia is concerned, these are two very easily modifiable factors that you can take in your life that can improve the hair loss that you might be facing at this point of time. Sometimes you might not know medicines that you might be taking for your blood pressure, medicines which you might be taking for your acne, retinoids, for your, if you're depressed or has anxiety, taking antidepressant, or you have someone who's epilepsy is taking an anticonvulsant. These medicines can sometimes cause hair loss. So you should always remember that every medicine does come with a side effects. In females, another very important cause of hair loss is the presence of PCOS. Again, visiting a gynecologist or and taking proper treatment for this polycystic kidney, polycystic ovarian disease or syndrome will result in amelioration and improvement of that hair loss. The last but definitely not the least will be the micronutrient deficiency. The subclinical micronutrient deficiency of zinc, biotin, and iron, especially in people who do not have another obvious cause of hair loss. In some people, it will be obvious, okay, it is male pattern baldness. Okay, it is a thyroid disease. Okay, it is, the stress which is causing. So in some people, if no cause is apparent, in these sort of idiopathic hair losses, another important cause is the subclinical deficiency of biotin, iron, and zinc. In such a scenario, what's important is you take a balanced, healthy diet. At the same point of time, certain supplements, health supplements, can definitely improve this type of hair loss. So this brings me to the part that if you're someone who's looking for a health supplement, I'll suggest this Mars by GSC, biotin, vitamin C, vitamin E, and zinc tablets all together. Definitely, if you have consulted your dermatologist and if you've felt that this is the particular reason for your hair loss and can improve and can be an adjunct in your treatment as far as hair loss is concerned, these Mars by GHC tablet, especially for men, these are the health supplement biotin tablets along with iron and zinc, will definitely help in reviewing or improving your hair loss. Other causes of hair, like I said, are your androgenetic alopecia. You can use minoxidil. Again, Mars is a good company to buy minoxidil as well. At the same point of time, alopecia areata. However, you yourself cannot diagnose what kind of hair loss you are having. It's always good to consult a dermatologist. So this is my journal public video for all of you. Thank you and have a nice day.